Heel pain is no joke. It can turn every step into a painful reminder that something isn't right. And if left untreated, it might lead to plantar fasciitis. But here's the twist. Treating plantar fasciitis ends up costing much more than most people expect. So today on the Confidence Blueprint, we uncovering the hidden expenses of heel pain, so you can understand the true cost of inaction and the value of taking charge of your foot health. We'll start by talking about the direct costs like medical bills and treatments, then move on to the indirect costs that often get overlooked. These include things like the impact on your daily life, lost productivity, and even emotional well-being. Let's dive in. One of the most immediate costs associated with heel pain is the expenses related to seeking professional help. For instance, visits to healthcare providers, diagnostic tests, and prescription medications can quickly add up. And while these are essential in the early stages, it's important to remember that they represent just the tip of the iceberg. The next layer of cost comes from treatments. People suffering from heel pain often explore various treatment options, from physical therapy to orthotics, steroid injections, or even surgery. Each of these has its own set of expenses, and might not always yield the desired results, leading to a cycle of trying multiple treatments. The financial burden here can be substantial and emotionally draining as you navigate through different therapies hoping for relief. So how much does treating plantar fasciitis really cost? According to studies, the average expenditure for treating plantar fasciitis ranges from $500 to $3,000 per person. But that's just an average. Your actual cost could be higher or lower depending on several factors such as the severity of your condition, the type of treatment you receive, and the geographical location of your healthcare provider. For example, if you opt for a more conservative approach initially, relying on rest, ice, and over-the-counter pain relievers might be significantly less costly compared to those who immediately seek out prescription medications or injections. Similarly, if you live in an area with a high cost of living and healthcare, your expenses are likely to be higher. But let's imagine for a moment that you've done everything right. You visited your doctor, got an accurate diagnosis, and followed their treatment plan meticulously. Even in this ideal scenario, the cost of treating plantar fasciitis can still mount up. Medications, physical therapy sessions, orthotics, and occasional steroid injections can easily push the total expense into the thousands of dollars. And even after investing all this money, there's no guarantee of a positive outcome. Plantar fasciitis is notorious for its unpredictability, and many people continue to experience symptoms despite undergoing treatment. In some cases, the condition might resolve on its own, but that could take months or even years. Or you might need to repeat the treatment process, adding more expenses to the mix. It's understandable that some individuals might consider the cost of treatment to be too high, especially when faced with the possibility of no improvement or the need to repeat the entire process. This leads us to a critical point. The financial burden of treating plantar fasciitis is significant. Understanding the potential costs involved in seeking professional help and treatments is crucial. While treatments can be beneficial, it's essential to consider both the monetary investment and the chance of success before committing. Remember, knowledge is power. By educating yourself about your condition and the available treatments, you can make informed decisions that align with your budget and long-term goals. And as you continue to learn about plantar fasciitis, you'll discover ways to actively manage your condition and potentially reduce these costs without sacrificing your well-being. Stay tuned to uncover the surprising ways to alleviate your heel pain and keep more money in your pocket. But first, let's shift our focus to another aspect of the hidden costs associated with heel pain, the indirect costs. These are often overlooked, yet they can be equally significant. The first indirect cost we'll discuss is the impact on your daily life. When dealing with heel pain, everyday activities can become challenging. Simple tasks like walking, standing for extended periods, or going up and down stairs might cause discomfort or even become painful. As a result, you might need to alter your daily routines, which can disrupt your schedule and limit your mobility. Imagine needing to take a different route to work to avoid going up hills or having to sit down more frequently during the day. These types of adjustments not only affect your comfort, but can also impact your productivity and overall quality of life. Next, let's talk about the impact on your personal relationships. Heel pain can be a source of frustration and sometimes embarrassment, and it can strain your relationships with friends and family members. You might feel reluctant to participate in activities you once enjoyed, like hiking or playing sports, and that can lead to a sense of isolation. Communication and understanding are key in maintaining your relationships while dealing with heel pain. Talking openly with your loved ones about your condition and limitations can help them provide the necessary support and understanding during tough times. Moving on to the impact on your work or studies, heel pain can be particularly problematic if your job requires you to be on your feet all day or perform repetitive motions. It can also make it difficult to concentrate or be productive if the pain is constant and distracting. In these situations, you might need to take time off work or miss important assignments, which can have consequences for your career or academic progress. If you're experiencing heel pain in a work environment, it's essential to communicate with your employer about your condition and any necessary accommodations. Maintaining open communication can help ensure that your rights and needs are met while you work towards recovering full functionality in your feet. Next, let's discuss the financial implications of missed work or reduced productivity. If heel pain forces you to take time off work or reduces your ability to perform your job effectively, it can lead to lost income or reduced productivity. This can be a significant financial setback, especially if you're the primary breadwinner for your family. Furthermore, the emotional toll of dealing with persistent pain can lead to increased stress and decreased morale. The emotional burden associated with heel pain can impact your mental health and general well-being. Dealing with the pain, frustration, and uncertainty about the future can lead to heightened stress levels, anxiety, and even depression in some cases. Recognizing these emotional challenges and seeking support are essential. Talking to friends, family, or a mental health professional can provide valuable, emotional support and help you cope with the mental health aspects of your journey. So the indirect costs of heel pain are extensive, ranging from personal relationships to work productivity and mental well-being. Recognizing and addressing these costs are crucial for your overall quality of life. By finding ways to manage your pain and maintain open communication with those around you, you can mitigate the negative impacts of heel pain on your daily life and future prospects. There are ways to tackle these costs effectively and start taking charge of your foot health. One approach is to focus on preventive measures, incorporating regular stretching, low-impact exercise, and maintaining a healthy weight can help reduce the risk of developing plantar fasciitis. Additionally, wearing supportive shoes and using orthotic inserts as recommended by healthcare professionals can provide early relief and prevent the condition from worsening. Another way to manage the costs associated with heel pain is to prioritize treatment options that have strong evidence of effectiveness. Consulting with a podiatrist or orthopedic specialist can help you make informed decisions regarding treatment plans. Evidence-based therapies such as physical therapy, extracorporeal, shockwave therapy, and corticosteroid injections have shown good results for plantar fasciitis sufferers. By focusing on these therapies, you can increase the likelihood of a positive outcome while minimizing unnecessary expenses. Moreover, it's essential to consider the long-term benefits of treatment. While addressing heel pain might require an initial investment of time and resources, failing to do so can lead to chronic pain and disability. Chronic plantar fasciitis can significantly impact your quality of life, making everyday activities increasingly challenging. By investing in treatment, you're not only improving your current situation, but also protecting your future well-being and independence. Furthermore, exploring alternative treatment options can be beneficial. Depending on the severity of your condition, you might want to consider non-invasive procedures like platelet-rich plasma injections or botulinum toxin injections. These options can provide relief without the need for surgery and can help you avoid the associated costs. Finally, don't underestimate the value of at-home self-management strategies. While professional help is essential, incorporating at-home exercises, stretches, and self-care practices can complement treatment plans and potentially reduce the need for expensive interventions. In conclusion, plantar fasciitis can bring a host of unexpected costs beyond just the price of treatment. From changes in your daily routine to financial setbacks due to missed work, the impacts can be. However, by staying proactive, prioritizing preventive measures, focusing on evidence-based treatments, exploring alternative options, and incorporating at-home self-management strategies, you can navigate these challenges more effectively. Remember that knowledge is your most powerful tool in managing plantar fasciitis, so continue to educate yourself, stay engaged in your treatment plan, and consult with healthcare professionals. Together, you can find the best path to managing your condition and keeping more money in your pocket while you stride confidently towards better foot health and an improved quality of life. Thank you for joining us on this episode of the Confidence Blueprint. We hope you found this information helpful and empowering. If you did, don't forget to give us a like and subscribe to our channel for more valuable content. Click the link below to access more resources from our channel and visit our website for additional tips and support. We appreciate your support and look forward to bringing you more insightful health and wellness content in the future. Until then, stay well and take care.